New data from the Centers for Disease Control and Prevention tonight show infant mortality rates have risen sharply for more than the last 20 years or so. 11 Alive's Karis Belger breaks down the number for Georgia and what you and your family should know.
Well, Georgia was one of the states that saw a sharp spike in infant mortality rates. And Corey Moss with March of Dimes tells me one way to ensure healthy babies is to ensure healthy mothers.
Corey Moss says he and his wife Kendall were ecstatic when they first learned they were having triplets.
I felt like we were Superman and Superwoman.
But at 18 weeks, there were complications, which led to the children being born early.
At 25 weeks and 5 days, they were 1.10, 1.9, and 1.13 ounces at birth. And actually, 2 of them after a month passed away.
He tells me one triplet, Kellen, survived.
Is.
And 19 years and another daughter later, he and his family are committed to helping other families and preventing them from losing children. He's now a board member with March of Dimes and says one way to do that work is extensive prenatal and postnatal care for moms.
Then if we can keep them healthy at the beginning, then we have opportunity for better outcomes for the babies and thereafter too. So really that's kind of the most important thing.
Even more so, he says, because of the concerning new data from the CDC. According to the report, Georgia had 116 more infant deaths in 2022 than in 2021. The main causes nationwide, maternal complications, and bacterial meningitis. But there are multiple factors. Dr. Joanna Dologoff is a spokesperson for the American Academy of Pediatrics. She says other potential health concerns like RSV are why it's important families stay vigilant.
It's not clear exactly what this means for infants in our state. However, it does tell us that we need to watch our babies very closely.
And I did reach out to the Georgia Department of Public Health. A spokesperson explained the state did launch a pilot program to bring mobile maternal care to families in rural areas where it's harder for women to find a doctor, and they hope to catch those complications that lead to infant mortality and other outcomes earlier in a woman's pregnancy.
All right, Karis, thank you so much. And to read more about this latest data just released, look for this story on our website, 11alive.com.